should a national lockdown be imposed? What's your experience of a national lockdown? Should it be done? Should it be not? Will we be in a sort of a advantageous position if we were to do that? But before I do that, Mr. PKD Nambiar, who was supposed to join us earlier, Mr. Nambiar is now with us. Mr. Nambiar, we had Mr. P. Chidambaram on our show, who said that there should be no taxation on import of medical equipment from abroad. This is not the time to collect taxes. Why does the government want to tax in the times of a pandemic?
I think I was listening to Mr. Chidambaram entirely, the entire interview between you and him. The only thing which I feel that Mr. Chidambaram is not living in India anymore. Today, the country's problem is that not about the taxation on these equipments or these the oxygen. Today, the main thing which we are lacking is that we do not have these things available. Nobody is worried about the tax today. Today, you give me oxygen, I am ready to pay. Who is talking about the taxes today?
No, Mr. Nambiar, but it has to be affordable also, no? You're saying everybody is willing to pay. It's not like they're doing it out of a very happy heart. Sanket, this is their compulsion that they're willing to pay.
Sanket, the challenges of today is as follows. There is no hospital beds. The hospitals do not have oxygen. There is not enough remedicine.
No, so importing oxygen is also a challenge.
Life-saving medicines. These are the challenges.
No, that is why we were importing. No, this is why we were importing. Because there was a challenge and a problem. There was a problem of oxygen. That's why we are importing oxygen concentrators. Now, if we were to tax those oxygen concentrators, you tell me how much sense does this make?
I am only saying that at least 5 of my friends who are importing these machines, they are not able to import that not because of a tax issues. It is taking so much of time. There is a supply side issue. The supply side issue, anybody who understands the basic economics, in 3 weeks time, these cases have gone up to such a large numbers. So there is today's challenge in this country we are facing is the supply side issue, not the tax issue. But I am not saying that there should be taxes. I would be very happy in any such kind of a situation. There should be zero tax for everything.
That's exactly the point.
Yeah. But in the meantime, but today let us not deviate the complete issue. Today the country is facing a challenge of a supply side issue.
Mr. Nambiar, while I agree with what you're saying, the point is,
people in Delhi ready to pay as much as money for a hospital bed. Will you be able to give them a hospital bed? That should be the question today.
No, that is also a question. This is also a question. Why should the government be taxing? And as if the government has done some sort of a favor reducing it from 28 to 12. Our question is, why this 12 also?
One question you asked Mr. Chidambaram, is there any earlier precedents which related to something like this? He was not able to. He was a former finance minister, one of the longest serving the minister in this country. He was not able to tell anything. So, but I am not saying that there should be taxes. There should not be any taxes.
Okay.
But let us not deviate the crisis.
No, nobody is deviating. This is as much as an issue as is the crisis that we are presently.
Let's not make any state government and the central government as the villains. Everybody wanted to support the system, but then yes, we are in a crisis. The last time in the first wave, the peak was 93,000. Today we are standing on 4 lakhs.
Absolutely, which is why we need these oxygen concentrators more, which is why we need all this equipment more, and that too at affordable rates. As you must have heard the doctors also, they are saying flood the markets. You cannot flood the markets and at the same time profit from it. That's the only limited point. Mr. Nambiar, I've run out of time, but thank you very much. Let's quickly move on to our discussion number 2. But before I do that, let's quickly listen into Dr. V.K. Paul. What did he say when the question was asked on imposing a national lockdown?
जब वायरस का स्प्रेड बढ़ता है, एक्सेसिव होता है, तो चेन्स ऑफ ट्रांसमिशन को रोकने के जो बाकी एफर्ट्स हैं उनके साथ में रिस्ट्रिक्शंस को भी बीच में लाया जाता है. और इस कॉन्टेक्स्ट में 29 अप्रैल को डिटेल गाइडलाइन इशू करी गई हैं. दोज ऑप्शंस आर ऑलवेज बीइंग डिस्कस्ड एंड दोज डिसीजंस एज रिक्वायर्ड विल बी टेकन, बट एट द सेम टाइम रिमेंबर दिस ऑलरेडी देयर इज अ वेरी सिग्निफिकेंट guidance to the states to impose restrictions in order to suppress the chains of transmission.
So options are under discussion, but we'll do what it needs to be done to suppress the chain of transmission. These are the words of Dr. V.K. Paul. Now, does he mean imposition of a national lockdown? I don't think so. But should there be a national lockdown? Let's ask the experts. We'll begin with you, Dr. Mahajan. What do you think?
Well, I feel, a total national lockdown may be an overkill. We have certain parts of the country where the COVID cases are very few. If you look at the Northeast, you look at other parts. So I don't believe that it should be a micro containment zone or a containment zone that should be created. Full states or part of states, especially where there is a huge surge of cases, they should be locked down. But what we are seeing is a very soft lockdown where weddings are allowed, where other activities are allowed, unlike the strict lockdown that we had earlier.
Interesting.
If we were to get a strict lockdown, even localized to a part of a state which has more cases, I'm sure we'll be able to break the chain of transmission.
Sure.
I feel at this point of time where there are geographical variations in the degree of infections and the surge is localized, we should actually do it more in a localized geographical manner rather than a blanket, lockdown across the country.
Sure.
Having said that, I would also urge the citizens that you need to do a personal lockdown. If we were able to do a personal lockdown, lock ourselves down in our homes, follow COVID appropriate behavior, don't crowd in places, I think a national lockdown may not even be necessary. Also, at the same time, we need to expand the vaccination drive. We need to take it to 6-7 million a day from the 1.5 million it has come down to.
Which should have happened by now.
We were doing 3 million. Now we should be actually targeting 1 crore because that will actually help us in having a smaller third wave, which is inevitable.
You're right. And we don't have much time. Dr. Garg, what do you think?
Yeah, I feel that, we have 12 states where we have got more than 1 lakh active cases. Then there are 7 states where we have between 50,000 to 1 lakh cases, active cases. And if we see the positivity rate, Goa has got positivity rate of 48%, Rajasthan 35%, West Bengal 32%, Delhi, Himachal, Karnataka again 30%. So I feel that the scenario has to be state to state. So that is important, and then it has to be a kind of a lockdown which is almost a complete lockdown because our districts within the states also have porous borders. So that's where even if we see NCR region, though I will like to bring to your attention that on 30th April we had maximum number of cases, and since then we are consistently having less than 4 lakh cases. But there is nothing, got to be happy about it. We have got to be much more vigilant with regard to these states. And particularly, as was mentioned by Dr. Mahajan, that when we look at the northeastern states and, like Tripura, Manipur, Arunachal Pradesh, Meghalaya and all those states, there's no need for lockdown over there. But it is also very, very important that from the public health perspective, I feel that it is the personal lockdown which is much more important. The people have to realize when they've got to go out, that is where it comes from self-empowerment, and when already the lockdowns will be there in these states, automatically the people learn that there is a lockdown. Earlier, I think just few days back, I never would imagine that Bihar people would understand. Now, if you talk to people of Bihar, they know that the cases are coming. They are going ahead with for the vaccinations and all that. So that's where we need to look at that. We need to have a multi-purpose strategy. And we need to go in a differential manner with regard to states.
Okay. Dr. Nagpal, your views.
Well, my view on this is slightly different. I would think that lockdown is not a solution, and it is not something which is likely to solve the situation. It has limited objectives. If you want to impose a lockdown, the objective should be clear. If you are wanting to tide over the overwhelming of the healthcare system, then those objectives, problems which are currently plaguing the healthcare system, for example, you want to make makeshift hospitals, for example, you want to increase bed capacity, those objectives and the implementation plan should be absolutely clear when you move into a lockdown in the stage that we are now. Now we are in the stage of, in Delhi NCR, we are in almost like rampant community transmission.
Correct.
At that stage, the only thing the lockdown is going to do is to give you some time. And you have to utilize that time to enhance your preparedness so that when the lockdown gets lifted, you are in a better state, because many times, as one has seen, and the epidemiologists predict that when lockdowns are lifted, there is also a release phenomenon where people tend to gather more, and there is more chances of transmission. So, in considering all of this, the objectives of a lockdown, the location of a lockdown, what do you seek to achieve from a lockdown, needs to be absolutely clear, and an implementation plan. What are you going to do with that time?
Correct.
You got 2 weeks, you got 4 weeks. What exactly are you going to achieve in that particular period? Because the infections
You can't treat lockdown like a cure. I think you have to use it judiciously. I think this is a point well made. Epidemiologists the world over say the same thing, that you have to judiciously use a lockdown. And if you can't use a lockdown, it cannot be your first option or the only option. Thank you very much. We've run out of time, but Dr. Nagpal, Dr. Mahajan, as well as Dr. Garg for joining us with your expert views on these two subjects.